I think we are. You know, what I'll do is introduce you. We've got a lot of folks on, but we've got more coming in every second. We've got more people joining us. So thank you, everybody, for hopping on this call. I am so excited to be hosting Dr. Ruth Roberts. I met Dr. Roberts last spring in Austin at a conference and was immediately taken with her message and her passion, and was just tickled to death that she agreed to do this talk. So we're the Woodlands Institute for Health and Wellness. We do functional integrative medicine. Our goal is root cause medicine. So we want to get to the root cause of patients' issues, fix those things rather than band-aiding symptoms with drugs. We treat men, women, and children. We take care of people that just want to stay on this side of the aging curve, all the way to our chronically, critically, terminally ill patients. So without further ado, I'm going to introduce Dr. Roberts. So Dr. Ruth, the trailblazer in holistic pet health coaching and the creator of the original CrockPet Diet, which I've got that book. It's amazing. If you don't have it, you should get it. Has dedicated her life to revolutionizing pet care. With over 30 years of experience as an integrative veterinarian, she's guided thousands of dogs and cats to overcome significant health challenges, including chronic kidney disease, GI disorders, allergies, and cancer. Her natural balanced approach to healing has empowered pets to thrive in body, mind, and spirit. Now, Dr. Ruth is expanding her mission to empower pet parents and professionals alike. Through her groundbreaking holistic pet health coach certification program, she's training a new generation of passionate advocates to provide personalized holistic care. These certified coaches work hand in paw with pet parents, offering expert guidance in nutrition, lifestyle, and natural therapies, all inspired by Dr. Ruth's pioneering vision. Together, they are reshaping the future of pet wellness, creating a world where every pet can live healthier and happier. So thank you, Dr. Ruth. I'm going to turn it over. You have a lot to tell us in a little bit of time.
Let's see how we can do it. So first of all, thank you all for inviting me in, because I think what I'm speaking about parallels so much of what your daily work is at the Woodlands Institute. If we knock the endocrine system out of whack, things don't work so well. So let's jump into it. Let's see how smart I am today. And I think that's got the slides for you, correct?
Yes.
Good deal. So I've been talking about Spay-Neuter Syndrome. And to be fair, we had to finally name it because it's this very confusing mishmash of symptoms. And we're starting to get a lot of information about it through the work of Dr. Michelle Kutzler and an organization called the Parsimus Foundation, which also supports human health. But what made me so passionate about this subject is this. We have a horrible incidence of cancer in dogs in the United States. Thankfully, cats are not so similarly affected, but the Veterinary Cancer Society estimates that 25% of all dogs will develop cancer. And when I say cancer, I mean a malignant, not a benign cancer. And 50% of dogs over the age of 10 will develop a malignant cancer. Those are horrifying stats. And I know that the incidence of cancer is coming up in humans, but it ain't that bad. Now, if we contrast that with Italy, and there's a couple of other studies I was just reviewing, we find that the incidence of cancer for male dogs is about 1.1% in Italy and 3.26% in female dogs. Now, that is a massive difference if we're thinking about 25% of all dogs and 50% of dogs over 10 to a very low percentage that more accurately kind of marks what we've seen on the human side. The other issue that is happening is that all of a sudden, and I've been in practice since 1990, chronic disease is just rampant. So we're seeing elevated rates of kidney disease, liver disease, intervertebral disc disease, arthritis, IBS, allergies, atopy. And more horrifying is that this is happening in dogs as young as 10 months. So, I mean, I can remember the first time I had to euthanize a 16-week-old puppy for fulminant lymphoma that was all over his body. And that's just insanity. So why? Why is this happening? As I said, I graduated in 1990, and in 1999, 2000, I literally took a tumor, a hemangiosarcoma, which is a very nasty malignant cancer, and the spleen out of a dog that was literally the size of a basketball, put it in the trash, cleaned up the dog's belly, sewed it up, and he never looked back. And then contrast that to 2012, where we're seeing dogs that went to the emergency clinic for a tumor the size of a golf ball that is ruptured, and they're dead in 6 months. So this was just puzzling the bejeebers out of me. What had changed? And what had changed is we got a little hint in 2013 when the UC Davis started studying, presenting a series of case reports or record reviews looking at golden retrievers, and then finally golden retrievers and Labradors. And what they found was that the incidence of joint disease, cancer, et cetera, was very, very low in intact dogs, but very elevated in animals that had been spayed and neutered. So this gave us a clue that spaying and neutering was involved. And it makes sense, right? We're basically removing the reproductive organs in dogs and cats as young as 8 weeks of age. So their endocrine systems never become competent. But the thing that helped us understand what precisely was going on was this first paper from Dr. Michelle Kutzler. And what she found was that the levels of luteinizing hormone were 20 to 30 times higher than that of intact pets. And more importantly, luteinizing hormone receptors were developing on tissues that shouldn't have a bunch of them. So this hormone began to alter how the cells responded. That is horrifying because I spent so much of my early career saying spaying and neutering is the way to go. This is what we should do to be responsible pet parents. And it's still part of it, but we need to figure out a way to sterilize them without impacting their system so profoundly. So this is why we can see that spayed and neutered dogs have an increased risk of lymphoma, hemangiosarcoma, mast cell cancer, osteosarcoma, and interestingly, neutered dogs have a much higher incidence of prostate cancer. So that makes no sense, right? What we expect is that we're going to see less cancer in terms of the prostate in these neutered dogs, but it's actually opposite. So what's causing this? This is the horror of everybody who is in functional medicine, but this is the hypothalamus, anterior pituitary gland, and gonad axis. You'll also probably hear Dr. McManus speak about the HAC, the hypothalamus, anterior pituitary, and then the adrenal glands. So in this case, what we're looking at is the way it should work. This intact post-pubertal mammal, this is a dog who's gone through puberty. What happens is these levels of estrogen, progesterone, and testosterone essentially become the feedback mechanism to tell the hypothalamus, we're all good. You can stop producing GnRH or gonadotropin-releasing hormone. And then that shuts down the production of hormones. So what happens in this flow is that hypothalamus produces GnRH, which then tells the anterior pituitary gland to produce luteinizing hormone. And that goes down to the gonads and helps them produce normal ovaries, normal eggs, normal sperm cells, and also to maintain endocrine body balance within the body. Now, when we spay or neuter, we have gonadectomized these animals. And when that shutoff mechanism is gone, there's no more normal levels of estrogen, progesterone, and testosterone. That feedback mechanism is completely gone. And so the hypothalamus produces more GnRH, which produces more luteinizing hormone from the anterior pituitary. And the cycle just keeps going on. and on, because there's no way for the body to know how to shut this off. Now, much like us, as these guys enter like almost immediate either menopause or andropause, their adrenal glands are responsible for making barely therapeutic levels of these hormones, estrogen, progesterone, and testosterone. So we have a system that's not working and adrenal glands that are stressed out in these dogs almost immediately after being spayed and neutered. So what does that end up doing? Where do these receptors end up really proliferating? And really, this is the list of places, but this leads to these types of problems. And this list of what happens is literally the list of chronic diseases I've been fighting for the last 20 some years. So how many of y'all have had a pet with one of these conditions? And if you want to sing out in the chat and say me, that'd be awesome. And then how many of you have had two or more animals, or an animal with two or more of these problems? Right? So this is, and yeah, I know somebody wants to help. This is Hayo, and you'll see her a little bit later in the slides as well. So that's precisely it. What we're seeing is just disastrous health consequences from this. So if we are unable to help these guys develop a feedback mechanism, then this is why they get into so much trouble. And that's where HRT starts to become discussed, and a couple of other things as well. But if you're not in an area where you have a vet that can help you with that, I've got some other suggestions too. So this, as I said, is truly the dawn of HRT for dogs. And thankfully, it's not a big issue in cats, but that may be something we discover later. So I was talking with Peter Tobias, a friend of mine. He was talking about his dog, Pax. And if you don't know Dr. Tobias, he is a homeopath. He's been doing, natural feeding, all this stuff for as long as I have. He got this beautiful dog. He got him neutered at about 2 years of age when he thought everything was stable. And over the next 4 months, Pax started limping. Pax couldn't keep up with Dr. Tobias any longer. And finally, Pax went to get out of the car to go on a hike and collapsed. And this terrified Peter, as you can imagine. But the good news is that he got in touch with the Parsonage Foundation and got some information on how to start HRT. So there's a combination of testosterone, which we can give to the female dogs as well. And there's a injection called, or an implant rather, called supralorin, which is used to sterilize dogs in the UK and pretty much any other country in the world except the United States. And the reason it's effective is that it is a gonadotropin-releasing hormone inhibitor. So that's why they stay sterilized if they're intact. And this is why we can use it actually as a potential support for dogs with Spay-Neuter syndrome. Now, as I said, this preliminary research has just started, and Dr. Linda Brent and Dr. Kutzler collaborated on this paper, actually Dr. Brent's dog, Toby. So this was the first successful case report of HRT using testosterone cypionate and supralorin to help get the LH levels back to normal. And what happened next was the Parsonage Foundation funded this study to look at different levels of testosterone to prove safety. And what they found was that at that initial dose, which is 0.5 milligram per kilogram of body weight, and 3x that dose and 5x that dose, all were completely safe. And interestingly, LH levels started to come down at that 3x and 5x dose. So this is, again, the first indication that we may not need two drugs. We may not need the supralorin and a hormone, but we have to get the dosing right and keep it safe. So that's the great news. But that's all about the boys, right? Because we think of testosterone as a male drug. So what about the girls? So there's Hayo, who's still here in my arms, hanging out. She is this is where it gets a little interesting, right? Because female dogs actually live with progesterone as the dominant hormone most of their lives. But if any of y'all are old enough, you've ever had a female dog that was incontinent, we used to call it hormone responsive incontinence because indeed it is, we would give them estradiol. And we could use that at a low weekly dose to control those symptoms. There's no research whatsoever, unfortunately, on either estradiol or progesterone for female dogs in terms of controlling the luteinizing hormone levels. And, if we look at how we would use this in women, I think it used to be they would say, oh, if you've been more than 10 years post-menopause, then your heart attack risk goes up after that. But I think now we know that's not true. I was just reviewing the A4M materials, and so estrogen can be beneficial for women at any age. So this is the next thing we have to figure out for our female dogs. Do we use testosterone? Do we use progesterone? Or do we use estrogen? And obviously, testosterone has the complication of being a controlled substance, so easier to use a progesterone or estrogen. Now, here's Hayo's story. In January of 24, she started developing problems related to a compressed disc in her neck. And Hayo's 15 now. She came to my mother with a broken front right leg, which twisted her spine all through life. And so this has given her arthritis and disc disease as a result of that sort of imbalance in her gait. It was horrible because we could not get her comfortable. She would get these zaps, really profound muscle spasms every time she went to eat. She started being fearful of eating, and she lost a terrific amount of weight. Also, we were starting to see her hair thin out and muscle loss happening. And she was just miserable. We had to bring in the prescription drugs, the prednisone, methocarbamol to relax the skeletal muscle spasms, and gabapentin, none of which are great long-term. So we started Hayo on testosterone therapy about a year ago using that 5x dose. And here's what happened. So I don't know if you can see the difference in her hair coat and the color, but this September of 25, can you see that the hair coat's much darker versus the June of 24 picture? This was fascinating. So she's regained muscle at this point. Her hair is darker. She has more energy. She feels much better, and she's starting to play with us again. This is a miracle in a 14-year-old dog. And indeed, there is a veterinarian that has a site called Dogsterone, where he teaches other veterinarians how to use testosterone to fight the frailty of aging, if you will, and arthritis. And basically, it goes back to helping them gain muscle, which is just critical. So this was pretty astonishing. I don't have data for her because I live in places where it's difficult to get lab testing for testosterone levels, et cetera. But what I can tell you is that her kidney values also improved, and she just feels so much better. And that's not supposed to, the kidney values improving is not supposed to happen at 14 and 15. So what do you do? If you have an intact dog, it's tough living with intact pets, and because we're not accustomed to that any longer. I think, if you start to understand what they're going to need, then it gets easier to understand, okay, if my female dog's coming in heat, there's going to be about 3 weeks of her behaving like my teenage daughter. She might be moody. She's going to be spotting. So you just have to be prepared for that. The other thing is ideally, and it's tough, right? Because there's most people are not accustomed to intact dogs in the US any longer. If you do need to spay, I would suggest that you wait for a minimum of 2 heat cycles for female dogs, and honestly, at least 24 months for males. But I just told you the story about Dr. Tobias's dog, Pax. He thought he had it all dialed in, and Pax still had a hard time dealing with being neutered. And from the Old Gray Muzzle Tour, this gentleman is a veterinarian who worked for a longevity institute. He was using Rottweilers as his study model. And what he realized was that the intact animals were living longer. And when he visited private owners with old Rottweilers, and I'm talking 12, 13, 14, 15, 16, which is unheard of in this time for Rotties, what he found was that they had some difficulty, some stiffness, that kind of stuff, but really their lives were very high quality until the end. And more importantly, they were dying with cancer instead of cancer. So his suggestion was to wait at least 5 years, which takes us to basically menopause, andropause age, roughly 45, 50. But the truth is that if you've lived with an intact dog for 5 years, the next 7 are not going to be a big deal. So what are the options to sterilize without removing the gonads? And if you've got an intact puppy, young dog, and you're having problems in terms of behavior, getting them into boarding kennels, et cetera, these are the options you've got. One is the supralorin implant. While it is not approved by the FDA for dogs and cats in the United States, it is approved for ferrets. And so there are some veterinarians that are willing to have the discussion about using it off-label for dogs. And the second option is an ovary-sparing spay. The third option for females is a fallopian tube ligation, just like us, getting the tubes tied. And then for male dogs, a vasectomy. And if you go to this website, parsimus.org, they have a terrific amount of information about why, and also, more importantly, training videos for veterinarians so that they can learn how to do these gonad-sparing spays and neuters. Now, here's the potential health risks of having an intact dog, because there are some, and if you're not aware of them, then you will get an unpleasant surprise potentially. So in terms of prostate disease, for intact males, infection or benign prostatic hyperplasia are possibilities. And the cancer for males, interestingly, is more common in neutered. But in male dogs that are intact, obviously, testicular cancer is a possibility. In female dogs, pyometra or a uterine infection is a distinct possibility. The current estimates out of Sweden are about 10% of intact female dogs develop a pyometra. It is a life-threatening situation, so it's something you need to be cognizant of. In clinical practice back in the 90s, before we started spaying and neutering everything, I would say the incidence was probably closer to 3%, something of that nature. And then for female dogs, breast cancer is a problem as well. And the upside of breast cancer in dogs is that 50% are benign, meaning they just stay there and never create problems, but that leaves 50% that are malignant. Of that, half of them are locally invasive, meaning they're just going to stay locally, but the other 25% have the potential to spread through the body. So this is something that is a serious concern. But again, if we're looking at 25% of all dogs developing cancer versus maybe 4% of intact dogs developing cancer, that's a risk I'd happily take. It was much easier to deal with either pyometra, breast cancer, or testicular cancer than it was with all of the stuff we're seeing today. Now, the other thing you need to be aware of if you keep your animal intact, or if you have a gonad-sparing surgery, is that many facilities will not permit intact pets inside of them. And so that's things like dog parks, boarding kennels, and doggy daycare. So that's where you want to kind of develop a dog pod that you can go hang out with and go hiking with. And honestly, a lot of it is just teaching proper manners to these intact dogs before they have a chance to learn bad behaviors. The way I kind of explain it is, if you had a hot rod, you have a Camaro or a T-Bird or something like that, would you give your 16-year-old son the keys to it? Unless he had demonstrated to you that he knows how to drive that vehicle safely calmly and respectfully. So that's really the key issue here, is helping people understand how to deal with these pets that are intact and what normal behaviors are and how to educate them away from potentially dangerous. Now, I've been talking about dogs, so what about cats? The good news is there's not a lot of health changes that we've seen in kitties. So the very first paper looking at luteinizing hormone levels in cats, we know that it's going up. And the interesting thing is we don't really know what it means. So we know that regardless of when these animals were spayed and neutered, that their luteinizing hormones go up at the same levels, roughly, whether they were spayed and neutered at 8 months or at 12 years. And we do see this significant increase in luteinizing hormone levels across the board. Now, what does that mean? We don't really know yet. And so what I did is a review of the literature on these chronic diseases. And so the interesting thing is that these Korea, the EU, and other countries typically, again, do not spay and neuter. And the incidence of cancer is roughly the same all the way through every country that kind of can give us some information. So, yay, elevated LH does not seem to increase the cancer risk in cats. Now, in terms of other diseases, what I did is go back and look at the incidence in 2000 roughly, which is when spay-neuter programs really took off. And the only significant increase really was in arthritis and hyperthyroidism. And the question is that related to the spaying and neutering, or is it because they're living longer and we're able to detect the disease earlier, or because they're becoming obese when they're spayed and neutered that they get these things? And that's the question that's still out for discussion. So what we'll need to see is more research into cats to see if there's any other health concerns that come along with it. So what do you do if you don't have a vet and that's willing to do hormone replacement therapy and your dog has already been sterilized? So there's a few things that you can do. One is you can go to your vet, send them the parsimus.org website, send them some articles so that they can see that there really is a scientific basis for the need to discuss hormone replacement therapy. Now, if that still isn't cutting it, the next thing I'm going to tell you is kind of great lifestyle management in general. And so it's what I call the 4 C's: chill, cavort, clean, and cook. So here's how we do it, right? If you get nothing else from this talk tonight, I want you to promise me that you will get off this call in sometime this evening, turn off your phone, turn off the television, and go outside, if that's possible, with your dog and just hang out completely focused on that animal so that you're establishing the connection. Going outside, putting your feet on the earth, letting the dog put his or her feet on the earth, grounds you and lets go of so much of the EMF waves we're concerned about, and frankly, of stress. If you are sitting there calmly, if you have a meditation practice or a practice of prayer, both of these bring you to the state of a parasympathetic state, or rest and digest, because the vast majority of us are staying in this state of sympathetic or fight or flight, and we can't heal if we're in that state constantly. Now, the next step is to cavort. There's loads of literature on the human side showing the impact of exercise on stress, on heart disease, on depression, on improving gut function, and all of that is true for our pets. If our pets are spending the vast majority of the time on the sofa, not moving, they're not getting that motion is lotion effect to keep things moving. Plus, it allows them to interact with the environment. They sniff, they scratch in the dirt, they enjoy, they play, they have a good time, and they're present with us and with themselves when they're on that walk. The third thing is clean water. I cannot state strongly enough how important this is. You need to, we've traveled with a Berkey filter for years, but honestly, I think we're going to switch to a distiller because of a myriad of issues. But at minimum, you need something that pulls out chlorine. The best option is something that's going to take out all of those halides, so chlorine, fluoride, all of that, plus herbicides, plus pesticides, plus bacteria and cysts. And ideally, this would have a filter that takes out micro or nanoplastics. If we can keep this out of our bodies and the dog's bodies, they have so much less to process and deal with. So it's one of those things we all talk about going on a detox, but the deal is to not let it in to start with. Then our bodies have less to deal with. So where do all these toxins come from? This picture has glyphosate on it, but honestly, anything you can think of that we're worried about right now follows this cycle. And this is called the hydrogeologic cycle. And so what the heck does that mean? So somebody sprays Roundup or the crops, fields, or whatever it is. What isn't stuck to the plants goes down into the soil, goes down into the creeks, the rivers, and ultimately the oceans. And then it's also vaporized. It as evaporates up into the air. Those little water molecules carry whatever it is we're worried about with them. They go up in the clouds. When it rains, it drops back down on the planet. And so this is why we're having such a hard time getting rid of this stuff, because it's just going through this cycle and not being filtered out by anything. So this is, you could put in here DDT, PFASs, anything that you're worried about, and it's following the cycle, including plastics. Now, the fourth thing is cooking. And I believe in home cooking for dogs. Many people feed raw, and I think that's a great thing as well. What's really important is to feed as much fresh, real food as is possible. So a minimally processed whole food diet is the thing that we need. Because I want you to remember this. Socrates didn't say, let food be thy medicine and medicine be thy food. He actually said, in food, excellent medicine can be found. In food, bad medicine can be found. And good and bad are relative. So this means that even though somebody is saying you should do it this way, you actually have to find what serves your dog best. This explains why there are so many superfood supplements that turn into super nightmares if your dog is sensitive to them. So for me, again, minimally processed whole food diet includes a lot of vegetables, whole, organic, GMO-free grains, beans with high quality animal proteins along with healthy fats. And part of my strategy is to incorporate a lot of fiber, again, to help us with the detox process. That fiber sucks the evil spirits right out of your gut and takes it out where it's supposed to go. And it can also massively improve the diversity and the richness of the microbiome and provide the polyphenols that are so necessary to feed the good guys and improves the gut's ability to detox. So it's really confusing, right? Because you see all these options and you've got different people telling you that each is the right way. So you get the picture. You know that you need to do what's best for that animal sitting right in front of you. Now, the thing that's interesting is that we do have some studies starting to come out looking at the impact of food on health. And so we're seeing that mildly cooked human-grade dog diets demonstrate that they can dramatically alter the fecal microbiome without changing the fecal scores. So this is the interesting thing, right? Your dog's poop looks great, but the microbiome still may not be in balance. And there were some minor differences in blood gene expression, skin and coat health at 12 weeks. And their suggestion is that further period of study would show even more enhanced benefits. And then this is looking at the changes in branched chain amino acids creatine, carnosine, all of these good things within the dog's body. And what they saw, these are things that are going to help build gut diversity and improve the quality of life of your dog. And what they saw was that this treatment group had really decreased advanced glycation end products, or AGEs, which I think everybody is aware of now. These are the things that actually create scarring on tissues and cause disease. And then, so this is the first, and this study went over a year. This is the first long-term feeding study that evaluated these impacts and demonstrated dramatic and sustained impact that this diet could cause. And this is interesting. So the company that paid for it is the farmer's dog. And it gets criticized a lot because it's very high in carbohydrate and rice in specific. So, but this is interesting that it did improve dramatically these bits and pieces versus an extruded kibble diet. Let's see here. Now, I mentioned polyphenols a little earlier. And so you've been hearing to eat the rainbow, but guess what? The rainbow isn't for you. It's for the bugs. But these are the things that really create a tremendous improvement, not only in the microbiome, but in the things that the microbiome produces for us. And so we end up with all of these benefits that literally read like a laundry list of longevity supplements. So that's why this has become so powerful. Like Dr. McManus, I also use functional medicine to help support dogs and cats. There are 8 branches of functional medicine. The 3 that I focus on are detox, assimilation, digestion, and controlling inflammation. And I think I've got a bunch of slides, so I'm going to run through some of this a little bit quicker. So one of the things are to remove environmental toxins, right? So we talked briefly about this. They can mimic hormones. They can block cell function. And sadly, the Environmental Working Group estimates that dogs carry a toxic burden up to 63 times ours and cats 93 times. So that's not good. And the EPA has registered over 85,000 toxic chemicals, and we know that at least 794 are toxic. But we don't know about the rest because we haven't looked yet. So let's focus on a few of the big issues. And honestly, you've heard this. I mean, you know this. It's not just in the water anymore in terms of microplastics. They're everywhere, and unfortunately carry other stuff with them, like PCBs. Not good. You've seen this slide before already, so you know that mechanism. But again, as I said, it applies to everything. Heavy metals, chemicals. So what do? Remove what you have control over. If you have Teflon pans, please, please, please throw them out. This is when they first came out in the 90s, it was killing pet birds when you started cooking with them. All of these food, odor things, chemicals, all of this stuff, the packaging in pet food releases a huge amount of AGEs, flea meds, all of this stuff. So, and that's what the coaches can help you with, is working through how to figure out what's good and healthy in your house and what you need to make some shifts with. Now, the detox system, I think you know this, but it's incredibly important. The reason pets have more exposure is they're lower to the ground. They lick their feet, they groom themselves, and they ingest all of the stuff that's landing on their fur, anything they've walked through, and then we're applying pesticides directly to them, or giving a monthly or every 3-month chew that is filled with pesticides that has to go from the inside to the outside. So, yuck. And again, because they're spayed and neutered early in life, they never develop endocrine competency. Sorry, and I flipped the wrong way. There we go. Okay. So this is a story I want to tell you about. This is Natalie Lampus, and I think she's on this call. So Natalie has this dog, Jagger, and probably a couple of years ago, he had hideously high liver enzymes. And so Natalie went to the vet. The vet was telling her that, oh my God, your dog has Cushing's disease or cancer. And so Natalie got the runaround. Is this sounding familiar to anybody? She got sent to an internist to get evaluated, to get Jagger evaluated for cancer. The internist said, no, cancer doesn't typically elevate these liver enzymes this high. And so she had to really ask questions of every veterinarian she saw and say, no, thank you, in order to get to the bottom of things. So guess what was going on for Jagger? And this isn't the whole story, but this is what we were able to sort through for him. When she realized that, I mentioned somewhere in passing that the byproduct of fracking are these salts that end up getting used to melt salt. And so, dogs are walking on the sidewalk and then licking the stuff off their feet. So she's like, oh, yeah. So she started walking or wiping Jagger's feet down really carefully afterwards. And then by the time she got to the oncologist, she pulled a few supplements out that we were a little suspicious about, maybe contaminated. And by the time she got to the oncologist, Jagger's liver enzymes had been cut in half, just with a few simple changes. She optimized his diet and did a couple of other things. And when she realized this about the de-icing stuff, she was able to really continue to work to bring those liver enzymes down, never quite to normal, but down markedly. And Natalie thought that Jagger was doing okay. But when he got those enzyme values down, he started to feel a heck of a lot better. So this is the power of detoxification and doing very simple things to help speed that up. Now, the next thing we talk about a lot is fixing the gut, right? That's a huge topic, but you can do this really, really simply and also improve the body's ability to detoxify. So we can use things like milk thistle, like liposomal glutathione, like binders to help take out these chemicals that we don't want our pets experiencing. And, the gut's important, but good assimilation and digestion is critical. So pets develop leaky gut syndrome as well. And then I think you probably know that you get a litany or a huge list of other problems that develop secondary to leaky gut. So IBS is super common in dogs and cats. One of the telltale signs that this is coming is often itchy skin, itchy ears, itchy anal glands. And sadly, if this progresses into IBS, this can develop into lymphoma, especially in cats. So not fun stuff. So this is Finn, and he's a 10-year-old sheepadoodle and just adorable. His mom, Maggie, was working with Michael Daly, one of the first holistic pet health coaches and a veterinary technician I worked with in my old practice. And he had horrible intervertebral disc disease. He'd had surgery and he was still in tremendous pain. So Michael came over to start doing massage for Finn. And Maggie was telling Michael all about this guy's woes. This guy's been on Apoquel, which is a medication used to suppress the immune system so that itching stops, for 6 years, and a hydrolyzed protein dry food, and he was still itchy. So he saw this incredibly depressed dog when he walked in, and his mom was really worried about him, but she just didn't know what else to do. So Michael said, I can help you with this. And he helped Maggie convert Finn over to the original CrockPet diet, the home-cooked diet I developed, add in probiotics, and also a supplement called Histopause, which is quercetin and stinging nettles, naturally reducing histamine levels. And they worked together. It took them 8 months, but they got Finn off of Apoquel. This is Finn in 2 weeks, finally eating happily for the first time in his life. And over that period of time, the plan was to start titrating down the Apoquel after the holidays. Michael called up Maggie to say, hey, how's it going? And she said, you'll never guess. My pet sitter forgot to give Finn Apoquel, and he's not itching. So do you think Michael's a hero to Maggie and Finn? This dog finally feels well for the first time in 6 years at 10 years of age. That's tragic. All right. The other bit is to control inflammation. If we are able to offer our dogs an anti-inflammatory whole food diet, help them heal that leaky gut, and then we can use bioresonance testing to determine what food sensitivities might be. Then we can help, our coaches can help pet guardians develop a rotation and elimination diet based on the test, and then use supplements targeted to supporting gut function. So here's the last case I want to share with you. And this is Thunder. She was actually my patient a lot of years ago. She was 6-year-old Mastiff, and unfortunately that's starting to get old for a Mastiff. She would not eat Chinese herbal supplements. This is when I was just learning acupuncture and TCBM. She would not let me put needles in her. So I created a diet for her, and we got her to take omega-3 fatty acids. She thought that was okay. And in 6 weeks, this dog went from barely being able to get up off the sofa to dragging mom down the walk and down the block while they're on their walks, just with 2 changes: food and adding a natural anti-inflammatory supplement. So this doesn't have to be hard or complex. That's what I'm trying to get you to understand, because we'll see influencers with you got to do all these things, but often it's just sitting down with somebody that can help you be guided through that process, to have the conversation about when did this start, what makes it worse, what makes it better, to help you get better guidance. So we're coming to the end of things. But here's the other story about Hayo. She came out of a house with 140 other dogs in it. And, she was just a wreck. The leg was broken, as I told you. She had basically PTSD because there was an incredible amount of abuse going on there. And she ended up living with my mother, who was very glad and got her rescued out of that situation. So here's my mother, who had high anxiety, and here's Hayo, who had high anxiety, and they were just kind of mirroring this back and forth with each other. Unfortunately, my mom developed lung cancer in 2020 and died, so Hayo came to live with us. We were able to help get her anxiety down and helped her improve her ability to walk and to get around, and she was doing pretty happy. She was doing really well. But I mentioned in January of 24, she developed severe pain related to compressed discs in her neck and her thorax. And I didn't know what to do. Here I am, the veterinarian, and I'm paralyzed because my dog is suffering. We didn't know what to do. So I contacted one of my coaches, Melissa Sherman, who's also an animal communicator. And she worked with Hayo remotely and told us how she was feeling, what she was seeing, and helped me understand what was going on so that I could jump back in and do my job as Hayo's pet guardian and seek the help we needed to get her relief. Now, why am I telling you that? Because if I got paralyzed, I know if your cats are developing serious health challenges, it's overwhelming and you're not getting the support you need. So that is why, if you're getting this situation from the vet where they're saying that's all we can do, just know it's not. There are 150 certified holistic pet health coaches who have the training and the knowledge to support you, and they have my backing. Every Monday we meet and we go over cases. So just know there is another way. There is more information out there than you can deal with, but these are the folks that can help you distill it down into what you need to know to help your dog or your cat. So that's what I've got for you. I hope you enjoyed this. If you've got some questions, I'm happy to answer that because I think we've got a little more time. But I know this was a lot, but I hope it was helpful for you. So if you've got questions, go for it.
Dr. Ruth, thank you. That was amazing. And I am, wow. I mean, it just makes perfect sense though, with the patients that we see. and hormonal issues and the cascading effect, and gut issues and the cascading effect, and inflammation, and it just makes perfect sense. So in order for questions, I think probably because of the number of people, if you'll throw your question in the chat. Dr. Ruth, can you see the chat, or would you like for me to?
I got it. Yeah.
Got it. Okay. So I'll let you take it from there.
Lalo, that's it. So early in that barrage of slides, one of the places that LH receptors develop is in the brain. And so this can lead to behavioral issues. It can lead to very early cognitive decline. And so that's where we have to really start to use all of our tools. It is amazing if you have a veterinarian that's willing to do hormone replacement therapy, how much of an impact that can make. But I just showed you all of the other things that you can do, even if you don't have access to that. But it really boils down to making sure that they are leading that clean life, so to speak, with minimally processed foods, proper supplementation, and somebody to help you along the way, because it gets confusing.
Dr. Ruth, how can we get connected to one of your health coaches?
So if you go to my website, which I dropped in there, drruthroberts.com, there'll be a tab up at the top that says Find a Coach. And you'll be able to see them there. We're working on a quiz, which I'm very excited about. We hope to get finished by the end of this month, where you can, say you've got a dog or a cat, and then the challenges that you're dealing with, and it will help filter through and present you 4 or 5 coaches that do the things that you're looking for. And please.
I really appreciated your the quiz that you have on the Spay-Neuter Syndrome. So I took that quiz and was surprised to see what the results were. So if you've not done that quiz, check out our website and do that quiz and see if this can be applicable to your animal as well.
Right on. And that's been very helpful for people to understand this too. And then somebody's asking what to do if you have a 2.5-year-old female and just added a male puppy to the family. And I'm presuming these are both intact animals. It's all cool until she goes into heat. And then what you need to do is be cognizant. If she's 2.5, you kind of know what to expect with her heat cycles. And so you will need to be cognizant of keeping everybody separated and sort of safe, so to speak, so that there's not an unwanted pregnancy. So that's, again, a conversation to have with a veterinarian. Actually, Brenda Hess is on here. She is a breeder of many, many years, one of our coaches. And that's something that she or another coach that has breeding experience can help you understand how to keep them safely apart. And let's see, Susie's got an 8.5-year-old border collie that's intact and is becoming more aggressive to his half brother that's 6 months younger than him. And yes, neutering can actually make him more aggressive. So if they've been living together all of this time, I think that you may want to look at what else might be going on. Is this guy painful? Has he got an upset stomach? Is there some other health issue that would make him feel cranky? And his brother comes up and is like, "Hey, what's going on, man?" And big brother's like, "Shut up." So see if that's part of what's happening. Very rarely will neutering solve a behavioral problem. It will slow down the drive. But if there is an aggression issue, this is where I would work with a local trainer and then also go back to your vet and say, "Can you help me find anything else?" And again, this is where a coach can help you go through a list of questions that could direct you to one body area, etc. And Patricia, go to parsimus.org and make a donation there, because they are the ones that have spearheaded the research and also the education of veterinarians. Right on. And Connie, good for you. Homeopathy is not my forte, but this is where glandular supplements can be very helpful in terms of providing the raw material really at this point for the adrenal glands to help the body function. So how do you monitor for pyometra? That's a great question too. So if your female dog has gone through heat cycle And 3 to 6 weeks later, all of a sudden, she's acting like she's going through heat again. The vulva is swelling. She's licking, that kind of thing. That likely is pyometra, and that's where you need to go. You need to go see your vet. And you've got two intact. Well, the female is intact. The male has been had a vasectomy, so he cannot impregnate her. So there's your safety mechanism. But the other thing is that if she's not what they call in standing heat, she may take offense to his overtures. So you do have to be careful about that. Right on. And Kimberly's got 2 bitches, 2 dogs. Yeah, and that's it, right? Women, like if you've been in a dormitory experience within a month, everybody is cycling at the same time. Same thing with our dogs. Yeah, you haven't had much sleep in a month. I get it. So it's tough. I mean, it's something you have to adapt to. But we used to live with intact animals until the 90s. And granted, there were a lot of unwanted litters of puppies and kittens. And to be fair, I mean, that's part of what this whole spaying and neutering movement was about, was to control that overpopulation. But it had consequences we had no idea were coming. And it took us 20 years to put it together, which is even sadder. Cool. Any other questions, y'all? Brenda, I think you have a video coming up teaching people how to live with intact animals. Right on. Cool. Well, Kim, Dr. McManus, this has been an absolute pleasure to come into your community and give you this information. So mostly what I want you to know is that you're not alone. And if your vet's told you that's all we can do, there is help elsewhere. So thank you so much for having us in, for letting me present this material to you, and let us know how we can help you. You can always reach out at the website.
Thank you so much. And I just really appreciate your time and your expertise. This has been amazing. I am confident that our audience is going to want you back to talk about something else. So you guys have to check out her CrockPet cookbook. It's on her website. It's cheap. It's great. So coaches also can be found on our website. We will be posting this talk, and we'll email everyone who was in attendance and let you know when that's available. It'll be probably a week or two, but we'll let you know. And just, thank you guys. This has been an absolute pleasure. If any of you guys want more information about our clinic, feel free to email the same email where you got this link, the RSVP it will get to me. And I'll be happy to kind of walk you through what functional medicine looks like for people. So thanks again, guys. It has been amazing. Blessings to everybody. And I'm going to go and do my 4 C's tonight. I'm committed. My 4 C's.
Right on.
Yes.
Right on. Thank you all again.
All right. You guys are great. Thank you. Denise, this was amazing. I know. I loved it.